So I'll tell you the story of my great-grandmother.
My grandmother was 90 years old.
My father had sort of a slow decline in his health, and he was in and out of emergency departments all the time.
There was a cascade of healthcare events which prevented us from taking my grandmother home.
So she fell multiple times. She had frailty issues. She had multiple surgeries because of her falls.
But then as things started to decline, we couldn't take care of her anymore. We couldn't get her to the care. We couldn't get the help that we needed in the home. And so we wound up, much to our dismay, having to put her in a nursing home, which is not something that she ever wanted, nor was it something that we ever wanted.
Well, if you're not a senior, chances are you know a senior. You have a mother or father who's a senior, an aunt or uncle. And it's important that if there are alternatives to being in the hospital, if there are ways to keep patients healthy and in their homes, that's going to be a tremendous benefit to them, to their families, to their loved ones, and to the system as well.
If we are to have a rational healthcare system, and we urgently need that because of the aging of the population and the costs that are bankrupting our society, we need to flip it so that the resources, instead of being focused on these ivory and marble and glass towers, these huge medical centers, that the resources shift to the community and orbit around the patient and the family.
At West Health, our strategy is to enable successful aging, to ensure that the delivery of healthcare, the services and supports beyond healthcare are designed and deployed to address the holistic needs of a senior and their families.
It's both rewarding but also eye-opening to see the number of areas where we are now developing capabilities to intervene and improve care. And it's coming to life through some of the innovations and the work we are doing. It's coming to life through stories that we hear from our collaborators.
We can't accomplish anything alone. And we've made tremendous inroads, and we've done that with a world-class team and a world-class network of partners.
One thing we know is that the hospital can be a dangerous place for older adults, and there are so many things that we know now to do that make such a difference. And what happens to the older adults now, it's just night and day.
It makes a big difference, and it's wonderful. You don't feel like you're in the hospital. It's well worth it. It gives you more strength to go on.
Well, I've been extraordinarily impressed with the West Health Institute in terms of their commitment, their knowledge, their willingness to sort of go where the evidence leads them in terms of what are the innovations, what are the types of new care models that are going to be most helpful, most impactful for seniors.
So in collaboration with West Health, we created this program looking at payment models and reimbursement, as well as focusing on how do we best set up a system to care for patients in the home setting and still give them equal, maybe even better care than they would receive in the hospital.
He's not weaker, he's getting stronger. That's the real value of this.
Hello, Doctor.
How's it going?
Okay, how are you?
I'm very excited to be able to work with West Health. We just feel very fortunate that they believe that we're one of the programs worthy of investment and collaboration and study so that we can add to the literature, the advocacy in this field together.
I'm very pleased with you and your whole operation.
Thank you. Yeah, that's great. So I've learned a lot, just from you, making sure that I listen. That's really important.
2017 has been a great year. It's been a year about putting our words into action. It's been about execution. And while we've executed on about 20 different medical research projects, we've also made major advancements in programs that are associated with West Health. that we have seen over 600 patients at the Gary and Mary West Senior Dental Center.
I lost my 4 grandparents at a very early age, so I didn't get that opportunity to spend that much time with them. And ever since then, I was always looking for grandparents to adopt. So here I have the opportunity to have about 600 grandparents. I like seeing them laugh. You never know who you might be able to impact with just that simple smiles.
I'm full of confidence now. I'll probably smile in my sleep.
I can actually eat like normal people. I'll be able to eat an apple. Now I don't have to be embarrassed because I do have to. I have something to smile about.
We have the very first geriatric emergency department in Southern California, which we are working in collaboration with UC San Diego Health. We've already implemented protocols, and those protocols are saving lives and changing the way that we practice emergency medicine in San Diego.
My hope with these standards is that we develop a set of best practices that any emergency department can implement, regardless of their size and their resource, because every emergency department is going to see these patients. The great part of this is that what West Health has done is really accelerated our focus as academic medical centers on improving the care for seniors in the emergency department.
And finally, we've received all of our certifications to officially launch the Gary and Mary West PACE program in North County, San Diego.
PACE is an acronym for Program of All-Inclusive Care for the Elderly. So the Gary and Mary West PACE program combines all of the different components of healthcare and support services to maintain someone or to allow someone the ability to remain living as independently as possible in their home and community. And so for me, it's very exciting to have this opportunity to pull all these pieces together. That could really have a huge impact on cost. It could have a huge impact on care. How do we create that environment that allows people to enjoy the time they have left?
We can make quality of life better, help people live better, help them do the things that they love and care about, help them stay at home.
We have to fix the trajectory of healthcare in the US, and we have to do that because seniors deserve more than they're getting today, and in fact, all Americans deserve more than they're getting today.
It's about our parents, our grandparents, and it is about us. That is why the work of West Health is so important. There are not enough foundations and there are not enough medical research institutions doing what we are doing. It's incumbent upon us to continue the work and to forge the path forward that Gary and Mary have envisioned.